Attend, get the COVID vaccine, or go somewhere else for your organ transplant. Starting next week, UW Health in Madison will require transplant patients be vaccinated. One man who's waiting on a kidney told our Taylor Lumpkin he would rather go without life-saving surgery than get the shot.
A new COVID-19 vaccine mandate will soon go into effect at UW Health for those looking to get an organ transplant, leaving patients with one of two options: either get the shot or find another place to get a potentially life-saving operation.
It's kind of like a punch in the gut for me.
It's been almost a year since Corey Lee found out that he had polycystic kidney disease, an incurable genetic disorder that often leads to end-stage kidney failure. The newlywed was preparing to get on the transplant list at UW Health this year. That was until the Madison Hospital announced that it was making a change to its transplant policy.
It just hurts my heart as a spouse to have to now have one more hurdle in our way of him potentially getting a kidney.
On Thursday, UW Health announced that it will require patients to be fully vaccinated against COVID-19 by January 14th of next year in order to receive a transplant or be put on the wait list. The hospital cites the greater risk for transplant patients of severe illness or death from the virus. But Lee says he'll look for a kidney transplant elsewhere.
You can throw all the numbers at me about, the science this and the science that. To me, it's just too new.
According to UW Health, those on the wait list who aren't vaccinated by the deadline will have their status changed to inactive, something that Tiffany DeLorme, who's already had 2 kidney transplants in her lifetime, didn't want to happen as she waits for a third donor. She got her first vaccine dose Wednesday.
I was supposed to be ready to go, and then I called, and my coordinator had said that they now mandated the COVID shot. Me personally, I wasn't going to get it. I didn't feel comfortable. I really hate being on dialysis. It's really rough on me, and I have 2 kids that are really young, and I just really want to get a transplant. And I know that's the only way that I could get on the list.
UW Health's policy will go into effect starting next Monday. In Milwaukee, Taylor Lumpkin, TMJ4 News.
Taylor, thank you. It's important to note hospitals have long required many organ recipients or donors to have their vaccines, like hepatitis B or the MMR shot. We asked Freighter and the Medical College about their policy. As of right now, that hospital is not requiring COVID vaccines for transplant patients. They are simply strongly encouraged. Organ transplant wait lists are competitive. If you're a hopeful recipient, you are greatly outnumbering available donations. According to the Centers for Disease Control, on any given day, there are around 75,000 people in the U.S. on an active wait list for an organ. About 21,000 organs come from deceased donors each year. Another 6,000 come from living donors across the country.